Okay. Next on our agenda is our public comments. We have only one that is signed up today, and that is Sarah Jones with UEA. Sarah, you available to come on?
Good morning. Can you hear me?
Yes.
Great. Thank you. Good morning. I'm Dr. Sarah Jones with the Utah Education Association. And first of all, I'd like to just express my appreciation to what Board Member Hanson shared in his message this morning, and to thank all of you for the enormous amount of time you've been spending these past months in service of Utah students. So thank you for what you do. On September 18th, you received a letter from UEA regarding the need to increase state oversight and compliance measures to protect the health and safety of our public schools. One of the most frequent questions that we are hearing from educators across the state at this time is who actually has the authority to make decisions about school responses when there's an outbreak of COVID-19. Currently, we have guidelines and recommendations at the state level in place of requirements, and the lack of clear requirements about which practices are essential to keep school communities safe has created confusion at the local level and led to local interpretations of these health guidelines and recommendations. So can a local school board simply override state health guidelines by deciding not to move to remote learning when there are more than 15 cases of COVID-19 in a school? And should local school boards be making those decisions rather than health officials? Or what about decisions regarding shortening of the recommended 14-day quarantine or failing to enforce a mask mandate? These are the kind of concerns that we're hearing, and they're not just education decisions, they're health decisions. So health professionals must establish appropriate standards for mitigating health risk in public schools to ensure the safety of educators and students and to prevent community spread in the wider sense, because our schools do not exist in a vacuum. LEA leaders are not health professionals, though they wear very many hats. And they should not be put in the position to have to figure out which guidelines or recommendations are essential to follow. This lack of clarity has created anxiety and frustration among educators. Teachers need to feel safe now. Teachers need to feel supported now. We need to be aware of the impact all of these decisions are having on educators who are charged with implementing them in our schools. And so this is why we are continuing to call on the state board, along with the governor and along with health officials at the State Department of Health, to establish clear and enforceable requirements for our local boards of education. Thank you very much.
Thank you, Dr. Jones. That concludes our public comments.